Hi, I'm Dr. Mikel, and I'm going to do a little video today on muscle testing or applied kinesiology. So this is a technique I've used for over 20 years, and it's something I learned a long time ago as a way to give me more information when I'm working with patients. Applied kinesiology or muscle testing is a way of tapping into the wisdom of the body. And where is wisdom? So intelligence maybe lies in our brain, but wisdom really has to do with consciousness. It has to do with energy. It has to do with perception. And our body, our physical body, really has an energy field around it. We can measure that with Kirlian photography and actually see an aura. People have talked about auras, some people can see auras, but actually our physical energy system around our body is very sophisticated, much more complex even than an aura. And this energy field interacts and actually created and interacts with our nervous system, with our physical body, with our emotional body, and our spiritual body. So when we do a technique like muscle testing, we're actually tapping into that response, to the sensitivity of that field. And we can do that testing products. I can do that as an assessment. I can do that working with the unconscious. So it's really been a valuable tool for me to have. Now the idea with muscle testing is that we use a muscle of the body to give us a response, usually a yes or no response, a positive or negative response. The first time I ever saw muscle testing demonstrated was in a church, and they had a big guy up there, and they pushed down on his arm, and he was able to resist that and hold his arm out there. And of course everyone expected that. Then the lady put a little sugar on his tongue, and they tested his arm, and it immediately went weak. So that was kind of an aha. I mean, the sugar didn't physiologically make him weak. It was an energy response. And of course he recovered his strength right away. You know, a minute later he was strong again. But it just did demonstrate that a substance like sugar kind of had a negative energy effect. So that made me interested. Since that time, though, I've taken various classes that use muscle testing to determine or differentiate nutritional needs. I've used it in emotional releasing, neuromodulation technique, emotion code. So I've used it in a variety of different ways. But today I'm just going to do a little demonstration so you see what that is. If you haven't seen it before, you want to see how I use it. So when I do muscle testing, I stand on the right side of the body. I use their right arm. Unless they have an injury, I can also do it on the left. But I just have the patient hold their arm straight, fingers straight, wrist straight. I try not to apply too much pressure, just a little bit of pressure. And as I'm pushing the arm down, I'm asking them to resist that, to just keep their arm there as I push down, to resist my pushing it down. So good, she gave me a strong muscle. The autonomic nervous system will be a little disrupted if you put your hand over like the umbilicus or the belly button area. So to demonstrate a positive and negative muscle test, or strong and weak, resist. That's strong, it kind of locks, I can feel that lock. And then if I put my hand over her belly button, it goes weak. Are you applying about the same amount of resistance? Okay, perfect. If the person is giving you so much resistance that when I push her arm this way and let go, her arm kind of flies back, then you know she's applying too much resistance and that we're just getting into a muscle arm wrestling match, which you don't want to do. Sometimes that's hard, especially for guys. You know, they just want to show you they're really strong. So, you know, I can work with that a little bit, but it's a little bit like dancing. If I'm applying a lot of pressure, they'll apply a lot of resistance. So since I do this all day long, it is really better just to kind of have a light to medium touch. So again, resist. Good, her arm's strong, and it's weak when I put it over that autonomic nervous system interference area. So again, the technique is often used by me to get information. So one thing I usually do when I see a person is do a physical and history. I'll look at lab work, talk about symptoms, and then I'll do a physical exam. And then I'll, usually have them on the table because I've listened to their heart and palpated their abdomen and things. And then I'll do the muscle test at the end over their organs and glands, points that correlate with their organs and glands. Now, often I have areas or systems of the body that I'm suspecting might have a challenge, and sometimes they're in pretty good shape and I'm not really expecting anything. So I try to go into the muscle test with sort of not a lot of assumptions. Sometimes I'll gather information that surprises me, like the gallbladder will come up or a kidney, and then that makes me think about my evaluation, the symptom history, and then kind of reevaluate maybe or look closer into those areas that might come up as weak on the muscle test. I always try to reassure people. Everybody has some weak areas. We're testing one snapshot at this point in time, and a weak muscle just means there's a challenge. It doesn't mean you have a disease or even a condition. It just means there's a challenge today. And also, so don't start worrying about it, that you're going to have some weak areas and they'll be expected, and then we know what to work with. So again, if we have a straight arm, hand straight, wrist straight, I'm applying pressure, resist, good. And then I'll go over these points, the organs and glands, and just see what the muscle does. It gives me information. A strong muscle means things seem fine. A weak muscle could mean there's a challenge. So we'll start with their head, her brain, her pituitary gland. We're touching a food allergy point, thyroid, lungs, heart, liver, gallbladder, stomach, small intestine, colon, pancreas, uterus, ovary, bladder, kidney, adrenal, and breast. Okay? So you can see some of the points I actually touched the point, and then some, that might be more sensitive or personal, whether it's a man or a woman. I can just put my hand over that area. We still get a response. Now, any technique that you use, the longer you use it, the more you'll have a communication going on. It's almost like the system of the body, the energy field of the body is used to communicating you, or there's a familiarity I have with the response. So, I trust what I got, I'll write it down, see how it correlates to the symptom picture, and then move on from there. The next thing I usually do is test products. So there are multiple ways that you could help the digestive system, the liver, headaches, and I'll usually have formulated a treatment plan about how those organ systems are communicating or contributing to symptoms and to the interaction of those problems, those symptoms that people have. There's usually, in my mind, a formulation about how I'm going to approach that. But even if I'm going to work on liver detoxification or improving digestive health, I definitely have more than one tool on my shelf or in my modalities that I might use. So muscle testing comes in handy because I can see how the person responds to a product. Now, a product, I'll tell people, has its own energy field. So plants have an energy field, animals have an energy field, a building has an energy field, but definitely products have an energy field. And I'll tell people, when you walk into a room, like you walk into our clinic, you get a feeling. Yeah, some of it is by the color or the people that are there, but it's energy. Our energy field is like a cellular membrane, and almost everything that happens physiologically in our body is in response to how that energy is reacting to your field. So that's, getting more into quantum physics, but there's a reality to that, and I've learned to really trust that. So when I'm differentiating products, again, we're just testing the energy resonance of the product and how that's interacting with your field or your consciousness or your energy system. So we'll get a positive or a negative response, a strong muscle or a weak muscle. And again, I have assumptions. Sometimes the muscle testing surprises me. Sometimes it reinforces something for me. Or if I don't get a result I would expect, like I know you need a certain product, but it tests weak, it makes me maybe rethink my assumptions about my formulation of the treatment plan. So it's really invaluable, and I'll occasionally get an area or system of the body that's testing weak and will prompt me to investigate further, like do certain lab works, check the kidney, or do an EKG, or I will investigate further if it's something that's coming up unexpected and would seem more serious. So we'll test a few products here. Again, the test, her arm is straight. I'm pushing down lightly and she's resisting that. We have a nice strong muscle. And when I put my hand over that autonomic point, it weakens just like we'd expect. So then we'll just see what she needs. Okay, she tests really well for some digestive enzymes. Not so well for any female hormone balancing. Really well for some calcium and minerals. and not so well for any histamine. Don't have any allergies going on right now. Okay, good. All right. So again, it's a great technique. I use it every day. I really wanted to demonstrate this to you because I have a way I use the muscle test to ask and do treatment with the unconscious and emotions, working with that anxiety and depression picture. So I really love to share that. It's a really great formula or technique or formula to really give us information about how the unconscious works and how we can use that information to make changes here and now and create a kind of new moods, new reactions to situations, and kind of get through blocks. So I hope you look for that video on the emotion code, and I hope you enjoyed this video. If you have any questions, my contact information follows. Thanks for joining us.